Welcome to Martin Community College. This is Marty Flynn. I'm the Chair of Allied Health here and the Director of Medical Assisting. I teach medical assisting. With medical assisting, you're multi-skilled, multitask. You'll learn administrative skills, clinical skills, and laboratory skills. With the administrative skills, you can make appointments, you can do billing and coding, file insurance, work with medical records. And with the clinical side, you learn to draw blood, run various lab tests. You can take out sutures and staples. You can give injections. You'll learn about sterilization and how to use the autoclave, and assist with minor surgeries. So there's a variety of skills and tasks that you'll learn in our program. We have an associate degree and we have a certificate. So if you're interested, please let us know. Today I'm going to show you one of the skills that you would learn in medical assisting, and that deals with a intramuscular injection. So we learn how to do different injections. But today we're going to talk about the intramuscular. So normally the deltoid is a site we can use, and if you'll feel your shoulder, you'll feel for the acromion process, which is right about here, and you'll go 2 finger widths down, and that would be where your deltoid is. So that's a site we can use. We also a lot of times use the buttocks or the dorsogluteal. We have lots of mannequins that you get to practice on. And if we're going to give an injection, we would want to draw a line here and here, and our injection would be in this outer region here. We would want to avoid the middle area, because if you see the white portion here, that's actually your sciatic nerve. So we want to avoid hitting that. In babies, we don't normally give them injections in their buttocks because their sciatic nerve, they don't have good control over it, and it's kind of like a little fishing worm. It wiggles. Excuse me. So we want to avoid that area. If you were to hit it in an infant, you could possibly paralyze them. So normally in infants, we'll use the side of the leg, the vastus lateralis, for them. So we're going to get right into our intramuscular injection. So the first thing you want to do is go wash your hands. So I've washed my hands. I'm going to put on my gloves. I already have our medication drawn up. Drew it up from this little vial. And what we're going to do is we're going to take an alcohol swab and wipe off from the inside out. You would want that to kind of air dry. Your needle has a bevel or a slant to it. We always want the slant to be up. For a intramuscular injection, we're going to go in at a 90-degree angle, so we're going straight in. And you want to hold the skin kind of tight or taut. So you're going in, and you want to aspirate or pull back on the plunger to make sure you're not in a blood vessel. We're not, so we're going to push that medication in, pull our needle out, hold some pressure there. We're going to activate our safety device so we don't stick ourselves. And we're going to put our needle in a sharps container. With aspirating, you want to always aspirate because you don't want to be in a blood vessel. If you're in a blood vessel and you inject the medicine in the blood vessel, you're given the medication intravenously instead of intramuscularly. So we do not want to do that. And that's pretty much it when it comes to giving an intramuscular injection. We'd be glad to have you at MCC. Thank you.